invite Tomas Merino from Pontificia Universidad Catolica de Chile for his talk on training in radiation oncology in South America.
Thank you, Dan, and thank you to all the people that have hosted me in Roche, in Northwestern, and Loyola these days. I'm going to be talking about training in radiation oncology in South America and a few things about healthcare in South America and the National Cancer Plan that we are working on. So as you might already imagine, Latin America is a large area, has more than 600 million inhabitants, and there are important differences in income within those countries. But we do share a common culture and some problems like access to healthcare, inequality, and we have very few number of medical doctors, nurses, and hospitals within this region. So, if we go and look at cancer, we'll see that people that live in this region will have double the chances of dying, for example, from prostate cancer, 4 times the chances of dying from cervical or gastric cancer compared to the States. And if we look at this graph, we'll see that mortality is dropping nicely in the States, but it's pretty stable or even growing in many of the countries in that region. There is a problem with infrastructure, as we just saw in other sites, and this is the radiotherapy services worldwide. You see that this area is not that well served, and you'll see that we have about 1.5 per million in this area, far from what you have in France, Japan, or the States. There is variability, but nevertheless, this is a common problem in South America. And if we look at the workforce, and this is looking at the relation between medical oncologists and number of patients that they treat, some countries in the region like Peru, Chile, and Mexico are having some issues there. There's not only a problem with the number of oncologists, and this is from Chile, the number of radiation oncologists, but the distribution is a problem. If you go to the public system, you'll have less than 3 radons per million, and you'll have 12 in the private sector, so there is some issues too on that aspect. As I was saying, we are short in radiotherapy units, but also in terms of workforce for all this area, and I'm talking now about Latin America with 600 million, we are short in radiation oncologists, physics, and technicians. And in terms of the training, there's no reliable data about the programs, and I've been today looking at all the surveys that you have from the States, but we don't have reliable data on that. And many of the programs last 3 or 4 years, but haven't been validated by the local universities. So this is how Chile came with a national cancer plan last year, and now there's a national cancer law in the parliament that we expect should be approved in the next year. This is how I got involved in the national cancer plan, and specifically here to build the cancer network, strengthen the workforce in that area. This is what we have now in Chile. We have, sorry about this, we have very few cancer centers, most of them in the center of the country, and we expect for 2028 to double the cancer center capacity. And this comes with a problem in terms of the human resources. This is the number of current specialist gaps that we have in the public system. This is considering the projection on the new cancer centers. So this is the amount we are training, and we will need at least to double or triple the capacity in terms of training in very few years. So this is a complicated problem. The other thing that we face is that Santiago is a beautiful city, as you can see, but all the training programs are located in Santiago, not only for radiation oncology, but also for medical oncology and oncology surgery, and have very few spots available, about 10 to 11 in radiation oncology, 10 in medical oncology in all the country. So this amount of training capacity won't solve our problem in terms of gap. And I would say that that is just the tip of the iceberg, because we are also facing problems in training for non-oncology specialists. We need to work with these non-oncology specialists to have a multidisciplinary team, and with non-specialists and other health professionals like nurses to get appropriate prevention and referral to the specialist. We are working at the same time in funding with the universities to create new programs to get more residents and medical students into the hospitals, and with accreditation bodies to get the physicians and nurses that are coming from other countries in South America to be certified on time and get them into the workforce to help us with this. This is where I work at Catolica University. This is the Faculty of Medicine and the Faculty of Physics. And this is our cancer center, where that was the first cancer center that started a radiation oncology program about 14 years ago. So far it has trained only 10 radiation oncologists, and we are now in the process of updating the program to get the most of these new residents. We feel that we should be following this advice in terms of a competency-based training, although that's very difficult from what you can imagine. Our university has followed the Royal College of Canada, and so far 4 programs have been certified, but none of them on the oncology area. They are from internal medicine, pediatrics, and a few more. There are other initiatives that have been recently started. In 2017, there was a master that's organized and by FALP and sponsored by the International Agency of Atomic Energy, and that has faculty from different sites in South America and from Europe. These are the students that are coming from different countries in South America. And with that, I just want to give some conclusions and have some time for questions. As I have said, Latin America has a huge problem. We have a rising cancer prevalence with very limited workforce, and we really need innovation and creativity to develop new and effective programs with very limited resources. And I think it's very important to have alliance with national, regional, and international partners to achieve this goal. So, thank you.